The most important hormone that I work with in my practice is actually progesterone. Progesterone, I think, is the single most important thing that I do, period. And it's not the most exciting thing for most people.
I have seen lots of little articles that relate specifically to women when it comes to a lot of treatments or what's going on hormonally, and that there's just not nearly as much research as you would expect there to be.
None. Barely.
It's crazy.
It's offensive. They actually made a law requiring more research to be done in women. This is really sad. I mean, think about it. We've spent so much more money on understanding erectile dysfunction and so little in understanding women's pathology. Do you know oral contraceptives in women permanently reduces their ability to make free testosterone, creating permanent reductions in libido, confidence, assertiveness? That's documented. That testosterone is great, but it's a similar concept as estrogen. But the idea is, well, you want your doctor to first understand why you don't have it. We have such an estrogen-rich environment around us with the foods that we eat, the chemicals around us, the insecticides. Menopause in women starts in your mid-30s, believe it or not. When you put topical testosterone on a surface, you just put it on like a tabletop and leave it there for 10 years and come back, it's still there. I don't do topical hormones because it's unethical. There are no normal men anymore, or it's incredibly rare to see a 900 testosterone anymore.
Welcome to today's episode of the Invigor Medical Podcast. Today we are joined by Dr. Brendan McCarthy, who is the founder and chief medical officer of Protea Medical Center. He's an internationally recognized expert in hormone replacement therapy who is dedicated to empowering patients with knowledge about their health and well-being. Dr. McCarthy, welcome to the Invigor Medical Podcast. Thanks for joining us today.
Thank you so much for having me.
Oh, we're excited to have you. I know Derek's especially excited. He was ready to just throw the iPad out the window for this one because he has so much excitement, all the questions. Before we get diving into all the details of your knowledge and expertise, and I think this is going to be a great one because this is something that we talk about a lot and a lot of people have curiosity around. But let's talk a little bit, how did you get here? Like, why the chief medical officer of Protea? Maybe tell us what Protea Medical Center is and how you became an internationally recognized expert in hormone replacement therapy, because that's a big one there.
Yeah. You know when they teach you to do elevator speeches? Do you remember that whole thing?
Oh, yeah.
How to do an elevator
I'm
speech?
in sales, so I'm supposed to have that.
I freehand mine every single time.
Oh,
I don't
love
have a
it.
single one. It's always a little bit different, but it's the same story. But I never want to do two cans, so I'm going to. So, in essence, I started practicing, 20 years ago, and it was just me in a room, and then my wife joined me, and it was a very, very small practice, but what we did, I feel, had such a resonance with the people I saw, and it was just a very natural, organic growth. I am one of those practices that I start off in a single room, renting a single room in a small little shopping center, and I just slowly built office center, and just slowly built it up. I have a staff of 40 currently.
Wow.
There's 7 doctors. There's 3 nutritionists. There are med techs. There's pharmacy techs. It's been something that's grown, and I think it's grown because of what I do. And it's not me special, but I think the way it's approached, and I think I'm hearing a need. I think I'm serving it well. I think that's what's caused me to come to this place.
Yeah, that makes sense. I can appreciate that because my guess is that the general public, has a general idea of what hormones are, and they hear about things like hormone replacement, and especially if you're aging at all, like as a woman into menopause or as a man being concerned about testosterone levels, that it's maybe something you're thinking about but don't have a lot of knowledge surrounding.
Well, and there's a lot of misnomers too.
Sure.
It's like you go to the gym and you look at any ad, if they're playing TV, you look at any ad and like testosterone ads everywhere. It's like, boost your testosterone, build muscles, do this and this and this, get your life back. And, it's just like how much of that is true and how much of that is just, just totally made.
Yeah. So I'm excited for us to be able to dive into some of the specifics there. You told Derek a little bit ahead of time, but I think it's kind of a cool story. So I'd love for you to tell us Protea Medical Center. What is Protea and how did you get to that name?
I lived in Hawaii for a bit. I traveled a lot in my 20s, but when I was living in Hawaii, my wife and I were both there. We were both going to school, and a restaurant I worked at had these really interesting flowers, at every table. And then and I didn't know what it was until I was hiking and with a friend of mine. We went up to the Haleakala. You know, we can take a little bus up there and then hike through, and then I saw these. It's on above the tree line almost, and it's beautiful, but it's not very hospitable to plants. It's very windblown. There's these scrubby little bushes that grow these beautiful pincushion proteas on them, and I just thought that something that could be growing that is that beautiful in a place that's inhospitable. It's a way of saying that you could thrive in difficult environments. You could thrive in a place that's not easy. And if you look at like the Greek mythology of Proteus, which is a Titan, the idea is that, you know, they could transform into what they needed to be in each moment. And the word protein, all these things are concepts of being able to grow and change and evolve.
Prototype.
So Protea just became that for me.
Yeah.
Yeah, I love that. Okay, Derek, I'm going to let you go first because I know you're just like chomping at the bit. So why don't you lead us into the discussion?
Well, I definitely appreciate that. I generally, I have a lot of excitement for all of our guests, and Natalie, I think generally is better at welcoming them in, and I think that she's a little prettier than I am, so guests generally like to interface with her more than me. But I am super excited about today's topic. Hormone replacement, I think, is something that, like Natalie pointed out, there's a lot of misunderstanding. There's not a lot of there can be some like confusion or just lack of knowledge around the topic. And so, I think that there's hormones that affect just women. I guess maybe we can just talk about like what are the basic hormones. Let's maybe just start there. And I think these are hormones that people know in general, like estrogen, testosterone, growth hormone. But maybe there's other major players that you want to bring up.
You know, the most important hormone that I work with in my practice is actually progesterone. Progesterone, I think, is the single most important thing that I do, period. And it's not the most exciting thing for most people, but the population of women that are being underserved by medicine is profound. And when women present with depression, anxiety, and insomnia, you know, they're treated with, you know, Zoloft, Xanax, and, well, not as much Xanax as it used to be, and Ambien. And the concept is you just get medicated for these symptoms of depression, anxiety, insomnia, which are profoundly common in women. And when you run labs, you'll find that they are very low in progesterone. And when you treat a woman's progesterone, you're able to restore health in a way that they're not able to get through a pharmaceutical prescription. And I'm not afraid to prescribe any of those medications. I will prescribe when needed, but it's laziness, I feel, to prescribe something that's unnecessary when I can find out what's the cause.
And so progesterone, that's something, honestly, that I don't know a ton about. I know that it's present in human beings, right? It's present in both males and females, but plays more of a role in females. Can you talk a little bit more about like what it actually does in the body, and specifically how it touches on those symptoms that you're talking about? You know, lack of sleep, anxiety, those kind of things.
Well, most women, when they present to the clinic or any clinic, they go in for like PMS. You know, any kind of like disorder associated around their cycle. A lot of times they're just put on oral contraceptives. They're not run labs to understand what's going on. And what it is, progesterone, there's two halves. There's two parts of being a woman that are important in a cycle. The first half of the cycle, the first 2 weeks, is going to be associated with estrogen, and that's associated with growth and femininity. It's the idea of getting your body ready to become pregnant. And so that estrogen is in circulation in those first 2 weeks, stimulating all that tissue, the breasts, the uterus, the cervix, the ovaries, adipose. It's just basically getting you ready to go. And then you ovulate, and then there's a switch that happens. Your body starts putting more progesterone out. Now, progesterone goes back to that same tissue and it calms it down. It stops the breast tissue from being overstimulated. It stops the line of uterus from becoming too thick. It stops all these tissues. It just basically calms everything down. That's on the physical aspect. The other thing that progesterone does that's beautiful is it crosses the blood-brain barrier. Now, testosterone does this for men. But with women, it's primarily progesterone. Testosterone is necessary in women too, but I'll just give you that breakdown a little bit so we can segue into testosterone if you want after. But progesterone, when it crosses the blood-brain barrier, it gets converted to something called allopregnenolone, and that binds to the GABA receptor. That's the part where your body quenches that anxiety part of your brain and calms it down. If you don't have progesterone, you don't have allopregnenolone, no matter what, you can have a loving marriage, a great friendships, you can have the best support system. You just don't feel good. There's anxiety. You don't make as much serotonin, and you can lab that. Their serotonin levels will be low. And when serotonin's low, downstream metabolite of serotonin is going to be melatonin. You start seeing insomnia in those populations as well. So when you treat a woman with progesterone, you're securing her fertility, but you're also playing a big role in her brain chemistry. And that's really it's a big part of the practice for me.
Wow, that's incredible. I just learned so much in that last little like 20-minute segment right there. That was incredible.
Yeah. I think it makes sense because, as you said, you kind of just touched on testosterone a little bit as well. And I mean, for me as a woman, I'm like, know that estrogen and progesterone are going to play a bigger role with me, and testosterone more with men, but testosterone also plays a role for women too, right?
And progesterone in men.
And progesterone in men. So maybe let's kind of make the bridge of like, what is it that testosterone is doing in women and for women, and why is it important? And then progesterone for men.
Testosterone with women and men crosses the blood-brain barrier as well. For men, it has a better action on our anxiety.
Okay.
So the right levels of it is going to quench that anxiety for us as well. That's why men with low testosterone have more anxiety. The other thing it does is it goes to the amygdala, and it goes into that part of the brain that's associated with confidence, assertiveness, aggressiveness, risk-taking, libido, the fight or flight index. And these are all important parts of how you respond to stresses around you. When you have low androgen status, men or women, it's the same thing. You don't feel very confident. You don't feel very assertive. You don't set really good boundaries. And since we're not animals, like we're not like, territorial animals anymore, we're more emotional creatures. We're not very good with emotional boundaries when we have low testosterone. Libido doesn't feel like it should anymore. It's diminished. And you can have a great relationship. It just doesn't feel right, So testosterone in men and women is very different. It's about a magnitude of 10 is the difference between men and women. But that doesn't mean that it's not as important for women as it is for men. You just have to use the correct volume to get the right benefit for them. But
Sure.
it still works on both.
Sure.
It's just a different ratio.
Yeah.
Yes, sir.
Yeah.
What would be some signs, and in a woman, I'm curious now, for low testosterone?
When women are prescribed, it's women. Libido is a difficult one to talk about with women because there's so many other overlays in there, cultural overlays and social overlays. So it's difficult to kind of parse into that. But libido is a big one. Feeling confident. And when I said earlier, emotional boundaries, that's an important thing. Is like we as human beings, we set boundaries. So like I have this analogy. It goes back to, I always like to pick on myself because it's easier to point out my flaws than point out other people's flaws.
Sure.
So I just point this out. But early on in my marriage, I was slightly feral. You know what I mean? I didn't wash dishes like I should. I wasn't very clean. You know what I mean? And so when my wife and I got married, it's totally reasonable for her to say, "Hey, Brennan, can you just do your dishes?"
Yeah.
And I would do them because I want to be a good husband, because I care about her. I'm not a bad person. I'm just feral. And so I didn't really wash dishes very often. And so she would get sick and tired of asking me to do the dishes. Because every time I left the dishes in there, I was crossing a boundary. I was not regarding her in that moment. So my wife, like many women, just stopped bringing it up because she just wanted to keep dealing with it. So every time I crossed that boundary, she just let it happen. And over time, that resentment built up in the background. When you have adequate levels of androgens in your brain, you tend to set better boundaries, emotional boundaries. You're better at that. It's just biological. And it's not like something you have to force. You just are better at standing up for yourself or speaking your piece or speaking your mind.
Interesting.
And I think that's an important thing.
As you talk about testosterone, I think that there's this common conception that testosterone increases your aggression, right? And in a way that kind of ties to what you're talking about of like increased confidence, increased boundary setting, all those kinds of things. I'm going to bring up Huberman. Right? Now's the time. Anyone that has the stopwatch. One of the episodes he talked about testosterone. He said that testosterone doesn't necessarily increase aggressiveness per se, but that it increases kind of like whatever nature. It increases the drive for whatever that person is prone to do more of that thing. And so like I think they did this experiment where they increased the testosterone of like monks, and they were going to see if they were going to like get into really big fights with each other, but they just ended up doing even bigger, more grand signs of like charity,
service.
Acts of service towards each other. It's like so Friar Joe gave somebody his breakfast, and so then Friar Frank like came over and like made him a whole meal or something. And so like they're constantly one-upping each other in this kind of pursuit of what is really core to their identity. So I don't know, that's kind of a bit of a brain vomit there, but what is your take on that?
So the actual neurobiology of this, and there's a whole field of medicine called psychoneuroendocrinology. Great journal. Mouthful to say it though. But when you have good levels of androgens, all right. So say you have low androgens, you have low testosterone, and your amygdala is not toned; it's low toned. You just don't respond very well. You don't take that risk in your life. You don't speak up for yourself. You notice when we're kids, before you go through puberty and you have that surge of testosterone, your hand-eye coordination is not very good. Then when we go through puberty, hand-eye coordination picks up. When you go through the andropause, you'll notice people don't drive as well as they used to. Hand-eye coordination. These are important parts of brain chemistry. So when testosterone is low in these guys, that's important. But this is a point I want to bring with you. When you give a person adequate levels of testosterone or even supra-physiological levels of testosterone, the thing is that's just the amygdala. We're not animals. We have a frontal cortex that's this beautiful, robust frontal cortex. And so the impulse of the amygdala must go to the frontal cortex, and that's how you interpret it and express yourself. So that frontal cortex is full of how you were raised, your beliefs, your spirituality, like who you are as a man or as a woman. And so when you push from the amygdala and you respond through the frontal cortex, everything's lined up. Yeah, you're good. And you can have mega levels of testosterone. You're not a jerk. This is where it gets weird. If you have low levels of cortisol due to chronic stress, or you have low levels of serotonin due to biology or any number of reasons why you do, those two things when low, you're not able to kind of mitigate that impulse from the amygdala. And so now you just shoot raw aggressiveness. Where before you have a good frontal cortex, you aggressively pursue the things that matter to you. You're assertive in the things you believe in, but you're not cutting people off on the highway or shutting people down. You're saying, I really believe this is important. You pursue your dreams more, but you don't shut people down. It's a nuanced thing, that frontal cortex. And so when you have pathology of the serotonin or cortisol, yeah, that's true. That's a problem. But people with cortisol and serotonin deficits, the frontal cortex, a lot of times they already have certain neurological, more psychological pathology. Does that make sense?
That makes a lot of sense. Yeah, I don't know if you want to clarify.
No, I don't think so. I think what I'm getting is it's a very nuanced, complicated system, right?
You don't want to give one thing without knowing what's going to do.
Right.
I think that's I don't want to, say you're my patient.
Yeah.
And I could be any monkey out there can prescribe testosterone.
Sure.
And they do the marketing thing where it's like they play upon our insecurities. And they always play upon our insecurities with these things. I'm not sexy enough. I'm not strong enough. I'm not masculine enough. They play upon these insecurities in us. And then we feel like we have to go and do these things. So they go into these clinics and they get these protocols put on them. That what makes, I believe, us shine when we care for people is when I give them something, I think about them all the way through. Like, how is this hormone going to metabolize through their body? Will their body be able to handle this hormone? Like when I give them testosterone, am I thinking about him as a whole person? Like, where is this going to go? How's his cortisol? How's the serotonin? How's his life? You know what I mean?
Yeah. Well, I would also say, I'm guessing, it's important to test more than one thing because a lot of these hormones are working in cooperation with one another. Like I know, for example, I'd had labs done, probably in my 20s, and I remember getting them done. But just a couple years ago when I got them done, my nurse practitioner was like, do it on the 21st day of your cycle because it's important, like what your levels are. I want to know where you're at on your cycle because your progesterone being really high when you're at the beginning makes sense. But if I take it for you, or whatever, wherever it is on the cycle.
Yes, I hear you.
And I was like, why did nobody do that before?
Dude, when I started practicing 20 years ago, no one would run labs at the right time of the month. And this is 2000.
Yeah.
This is we'd already been on the moon. You know what I mean? Like, this is not new. And they
Right.
would still run labs any time of the month and just say it looks normal without really understanding the woman in front of them or the man in front of them.
I have seen lots of little articles, and I'm curious if you could speak to this. It's kind of adjacent to the conversation regarding how little research there actually is that relates specifically to women when it comes to a lot of treatments or what's going on hormonally, and that there's just not nearly as much research as you would expect there to be.
No.
Yeah.
None. Barely.
It's crazy.
It's offensive.
Yeah.
You're treated like you're little men. Then they knew this in the 1990s. They knew this, and they actually made a law requiring more research to be done in women. This is really sad.
Yeah.
And the World Health Initiative, looking at the nursing study for breast cancer, that they got it completely wrong. That was their attempt to correct this, but
Wow.
they still didn't do a very good job of that. They are so far behind in researching women. I mean, think about it. We've spent so much more money on understanding erectile dysfunction and so little in understanding women's pathology, like around PMS. More women will have PMS at any given day than a man has erectile dysfunction. But we spend a magnitude, I think it was 10, I have to look it up, just a magnitude more that we spend in that. And
Wow.
we don't really understand women at all.
So
I have a hard time with this one personally.
Yeah, no. And I appreciate your affront to it. If it makes me feel supported.
Yeah. What's right is right. You know what I
Yeah.
mean? What's right is right. And it shouldn't be just only women speaking out for this, because that's what's right is what's right. And this is not what's right anymore. This has got to stop.
I agree. And for you as a medical professional, I can imagine that it would help you to have more research to pull from to know how to better treat your patients, right?
Just to confirm, after you do 20 years, you kind of understand it. You get to that point, you're like, yeah, this is what we do. You know what I mean? It's just,
Yeah,
it's
just
it's
frustrating
like that
and
now. But no, we do need more research. I think more research into different types of contraceptives for women. We haven't come up with a new contraceptive. Do you know oral contraceptives in women permanently reduces their ability to make free testosterone, creating
That's
permanent
crazy.
reductions in libido, confidence, assertiveness? That's documented. That's not even alternative. But we have not come up with anything better.
No.
Nothing have we come up with better. We just make different versions of the same
Right.
garbage.
Yeah. And I think that's wild. That's an interesting thing to kind of bring up that's also adjacent to the conversation. You know, I got on birth control when I was 18 and was off of it within a year to a year and a half because I got a ton of weight gain and I was getting migraines. And my doctor was like, well, the estrogen is causing one and the progesterone is causing the other. And really the only thing I can do is give you birth control that is higher or lower in one of those two, but you're having an issue from both of them. So you should just be off of it. And I'm like, well, I'm 19 and I don't want to be pregnant, you know? And it was wild to me how few options there were, you know? So I ended up getting a diaphragm, which you can use with spermicide, which is what it is. You know, it's more effective than a condom, which is nice. But when I've talked to women now for years who are looking to do some kind of alternative kind of birth control, and I mention it to them and they go to their doctors and they don't even know how to get it. Like, we have so few options anyway, and one of the few non-hormonal birth control options, doctors don't even know how to get it. Like, wild. That's wild to me.
I know.
Yeah. All right. Well, I'm going to get off that soapbox because I feel like Derek had another question.
No, you brought up a whole nother slew of things. There's actually a clip that I wanted to share with you at some point, either during the show or after the show. But this guy, he was talking about how women being on birth control that affects their hormones as a byproduct actually affects men and their hormones. And so like there's this weird effect of like women being, you know, having artificially high levels of either estrogen or progesterone affecting even like the type of man that they're wanting to pursue. But then on top of that, now that birth control is like saturated essentially the population, that the hormonal effect is actually creating a secondary effect to men, and it's affecting how they present in the relationship. And like, anyways, super crazy. And you know, I don't know if there's necessarily any truth to that, but like, and maybe this would be a good time.
He's
maybe
nodding.
there'd be a good time to dive into this topic. Is like testosterone levels are across the population are the lowest they've ever been. Why is that?
Let me first just speak to something. I think I'm going to cry.
Oh.
Just feel this for a minute. You're married. This is your person. He does the dishes. It's a good marriage.
Yeah.
And you're taking contraceptives. You've been taking them all this whole time, and you don't have the natural libido anymore. But you love him. If you're the husband and you always feel like you have to initiate intimacy with your partner, your self-esteem starts dropping off. What's wrong with me? Why does she love me? You feel rejected. She feels like a failure. She can't do for him what she wants. She's not present in the marriage the way that it should be in a marriage where you're both intimate with one another. It is a true thing. And if you practice medicine enough and you pay attention, it's everywhere. It's a big deal. and then it gets forgotten about. There's so many cultural overlays as well. It's just, and female sexuality is a whole nother topic. There's a lot to it. But I mean, just from that biological part, it really does affect us. It affects us as a people, and it affects our marriages, it affects our intimacy with one another. So I have a real big issue with that. With men with testosterone dropping off, why? I learned, this is how I got into this. I didn't want to be an endocrinology specialist at all. That's not what I came in to do. I didn't want to specialize in women's medicine. These are not the things I wanted to do. I was actually very interested in environmental toxicology.
Okay.
That's what I wanted to do. And where I got good at environmental toxicology, during my fellowship and all these things, was it went back to my training, went back to how the environment kept causing harm in reproduction. So with women inhibiting ovulation, that's how I started getting into progesterone, because women were not ovulating, so I just started using progesterone. Men, no testosterone, plastics, microplastics. We knew about this 20 plus years ago, man. This is not new. We knew about BPAs and phthalates. We knew the permanent damages it was causing. We've known about this the whole time. This is not new. It's just now that it's gotten so bad, we can't hide from it anymore. It's microplastics and phthalates cause permanent damage to our germ cells and permanently inhibit our ability to make testosterone permanently.
Wow. And so, I mean, my brain is going in so many directions at the moment. I mean, so we've talked a little bit about like how these symptoms can present, right? I would guess that honestly, the best thing that you can do to find out is, like Natalie said, is just get your labs checked and get them done regularly, so that you can actually see and track over time, like, oh, I'm trending in the right direction or I'm trending in the wrong direction, and I should seek treatment, right? But when you actually go down to it, this almost feels like the cancer discussion, how like if you look up the list of everything that that's a carcinogen and that can cause cancer, it's like this enormous list that's almost makes you like not even want to try. I don't know if that's kind of the current condition of what's affecting our hormonal health as well. Like, is it such a like a massive list, or is it pretty targeted that like microplastics?
Let's put it into two camps.
Yeah.
What is synthetic that causes cancer, and what is natural that causes cancer? What is natural that causes a lower testosterone? What is synthetic that causes a low testosterone? Let's put it in those two places. And now when we go to the natural things that cause cancer, our bodies were made to handle them. The sun, for cancer, the sun. You see, I'm not coming up with too many natural things. How about low testosterone? Things in nature that cause low testosterone. Naturally occurring soy, not the GMO'd version or modified versions. No.
Hey, I hope you're enjoying today's podcast. I just wanted to take a quick break because if you're listening, you probably know what we do here at Invigor Medical Podcast, but maybe not what we do at invigormedical.com. So let me introduce us. At Invigor, we provide prescription strength treatments and peptides for weight loss, sexual health, and lifestyle optimization. Every treatment plan is carefully prescribed by licensed doctors and sourced from legitimate pharmacies. You don't ever need to buy questionable research chemicals again. And bonus, as a podcast listener, you get a 10% discount on your first treatment plan with code podcast10 at invigormedical.com. Now, let's get back to today's episode.
But
not to a significant degree.
Lots of soil do it. So when you say it's overwhelming, you're right, it's overwhelming because so much of our environment has become synthetic. So much of our diet has become synthetic. That's it. I mean, at the end of the day, if we really sat down and really thought it through on that way, a synthetic life is going to cause cancer and low testosterone. Just that's it. Now, your body, we are gifted with this amazing tool to navigate this world, that if you were able to build up your antioxidants in your body and take good care of yourself, you can push through a lot of environmental toxicity that could lead to cancer. Absolutely. Not permanently, and not, you're playing the odds a little bit, you're rolling the dice a little bit, but you're pretty safe for the most part. You can drink a certain amount. I mean, our ancestors have been drinking for a long time, so alcohol may not be as bad, but all the other things added to alcohol probably in our lives, the other things we do plus now alcohol combined, not good. Maybe that.
You bring up antioxidants. is something like glutathione, is that something that you use in your practice?
I run the labs on it all the time. I think it's a really important thing to run antioxidants in people. I run serum CoQ10, serum glutathione. Absolutely.
Awesome. Yeah, I mean, so we prescribe here at Invigor Medical, we prescribe glutathione as well, and kind of the moniker around it is that it's the master antioxidant. That it's like this massive kind of molecular structure that moves through the body and is able to suck up all those free radicals. Can you maybe touch a little bit more about like what glutathione is and the effects it has on the body?
Yeah, it's you said it, you hit it perfectly. It's your body makes glutathione. It's the end product of like all the antioxidants you take. You're trying to make glutathione.
Mm.
You know what I mean? It's the three proteins put together in your body. Now, there's some people that really go by the concept you can't take it in orally, and you know, because people buy a glutathione pill, people say, oh, you can't, that doesn't work, and some people say you have to do it as a patch, some people do it as IV, some people as IM. What I tell my patients is this: let me run your labs before and after. I've seen people do weird patches that I didn't think would work, and their glutathione went up. So I mean, if the patient is going to take something and increase their glutathione, like if they're going to take actual raw glutathione, we show them the lab work, you know, that it worked. IV, it's like you don't have to do labs; it's just it does it.
You
You
just
Right.
should run labs also, but you don't have to. It's going to work. But when I try and do things like diet, and I want to make sure they're eating foods that build natural glutathione, I run the labs around it too. And if their body's still not doing enough with fruits and vegetables in their diet, I'll start supplementing things. If I need to do IV or IM, I'll do that as well.
Incredible, incredible. While I feel like we're kind of on this tangent of treatments. Like, obviously, if someone's deficient in a hormone, right? So estrogen, testosterone, progesterone, like the most brute force way that you can treat them is just by literally giving them more of that hormone, right? But obviously that comes with upsides and downsides. I don't know. Maybe we can dive into those. And I'm thinking specifically about testosterone, but maybe I just because I don't have as much knowledge around estrogen and
Yeah,
progesterone.
testosterone's great.
Yeah, but
But it's a similar concept as estrogen. But the idea is, well, you want your doctor to first understand why you don't have it. Like
Yeah.
some guys, it's been diet. Once I've cleared up their diet, they start making testosterone. I'm happy. I feel like I've done the best. That's when I feel like I'm the best version of me because I got their body to make it itself. You know what I mean? I played that role in their lives. And I helped them change that part of their lives so now they're making it themselves. So I feel that's my best tool. If they're low, say you're making 200, your lab's around 200, I want you 900. I'm going to give you that 700 difference. That's what we're going to provide you with. Now, the different way I deliver it to the body, there's going to be different surges because I'm not natural. I'm not the original plan. There's I'll never be as good as God is my favorite saying with this because how your body would make it, how it's supposed to be in there, it's really well balanced and controlled for. If I'm giving you a week supply, a 7-day supply all at once, or a month supply, or whatever format we're using for you, I'm going to make a lot of other weird things happen because I'm giving you a bolus of it, a bunch of it at once. And I don't want to do that without watching what it could do. So with men, you want to make sure they're not turning, because testosterone will aromatize in your adipose, your body fat, into estrogen. You can overdo your testosterone, or it can make something called dihydrotestosterone. And dihydrotestosterone causes more side effects of testosterone, like hair loss, and oily skin, body hair. It's just that we want to make sure we watch that dihydro. It's associated with enlarged prostate as well. And we want to make sure that testosterone is not stimulating. So testosterone will go into your bone marrow and it'll stimulate your stem cells. And it's going to stimulate you to make more muscle. So that's good. But it's also going to make more red blood cells. And some guys, it makes way too many red blood cells and they have thick blood. So we have to reduce their dose or they have to donate blood.
which is why you normally test hematocrit with most testosterone treatments.
Yes, sir.
Great. I don't know. So that's testosterone. I don't know if you want to dive more into the estrogen and progesterone.
Yeah, I'm curious for sure on how that plays a role in women. And I would say also, like, is it more likely that you see women going through menopause who start to need these kind of hormone replacement therapies, or are you seeing it across all ages?
Women with progesterones across all ages.
Okay.
We have such an estrogen-rich environment around us with the foods that we eat, the chemicals around us, the insecticides. A lot of these things really do stimulate estrogen. And so we want to know if they're ovulating. We want to know if they're making progesterone. So we're always, throughout the life cycle of a woman, our progesterone is a big thing because, anxiety, depression, These are big things that happen in women in their 20s and 30s. It starts moving its way into insomnia in their late 30s, maybe more in the 40s usually, is when you start seeing that part. But menopause in women starts in your mid 30s, believe it or not. No one wants to talk about this. No woman wants to hear this. And it's true, and I know that. But when you turn your mid 30s, that's when you don't ovulate at every cycle. That's when you're going to start noticing, the fertility rates start to drop off because you don't ovulate as much. And if you're not ovulating, you're not going to make as much progesterone. So if progesterone's low, that's the first stages of menopause, is that diminished ovulation and diminished progesterone. That'll happen from your mid 30s all the way into your 40s. And then sooner or later, you start having drop-offs in your estrogen, and then it finally drops off completely, and that's full menopause.
Okay, so I'm in my mid to late 30s, 38, so technically late 30s. What are like some normal symptoms that you would be seeing, and is it an appropriate time to start, looking into HRT, hormone replacement therapy? Or is it just like, oh, this is normal, I just have to figure out how to deal with it?
Your population is the trickiest, because think about a woman in her mid 30s. The average woman in her mid 30s, and this is not all. Average woman in her mid 30s, mom, most likely working, nowadays most likely working, kids, married, husband. Those moms work 2 jobs, right? So most, not all. I know there's other ones, but I could talk about them too if you want to. But that average woman gets up in the morning. She makes sure the kids have their lunch. She makes sure they have their breakfast, their clothes match, the things they're supposed to do. They go on the bus. They go to their job. They work at this job. They usually don't get paid as much as their male counterparts. And that shows that women tend to work harder at their job to be acknowledged a little bit more. That's a fact. That's not arguable. And then women will come home, and then they get the kids ready to go on to their after school activities. They bring them to softball or soccer, whatever they do. They bring them back home. The mom then starts making dinner. She watches the kids make sure they're doing their homework, puts the dinner on the table, has dinner, does the dishes. I do dishes now, though. I'm much better at my dishes than my family, by the way. But she generally tends to do dishes and then make sure the kids brush their teeth, get off to bed. She'll start folding laundry, maybe have a glass of wine, watching a show, go to sleep, and start the day over the next day. Mm-hmm. The average woman works more hours in a day than the average man. That's not an arguable thing anymore. That is proven. Again, there's outliers. I know that, and that's good. And I hope they're good outliers, meaning they don't, that there's shared burden in the home. But that woman now, her adrenals, her cortisol levels are not going to be so good because she's working harder. And also in her mid-30s, to start realization, is this the life I want to live? How am I with my life? Where am I going? My children are growing up. What's my purpose now? All these things play a role, because then when you have cortisol issues in that population, cortisol is linked to progesterone. So if their progesterone is not naturally going down because they're in premenopause, it sure as heck is going to be low because of the stress levels that they're under. So that population woman, we want to understand, is this stress-induced low progesterone? Premenopause, early menopause, low progesterone? Some women dietary low progesterone. There's all these different things. So in your population, it's like we have to sit back and really take a lot of time to understand that woman in front of us, run the labs, and that's how we come to a better understanding how to treat them.
Yeah. I just felt tired thinking about you saying all of it, because man, and especially I'm tired today. I don't know if you could tell when I came in.
You can tell a little
My
bit.
energy is just like a little lower. I had a great weekend, but also there's a lot going on in my life right now. And there's a couple times where you start talking, I'm like, if I start talking right now, I'm going to cry because I'm just tired. And I'm a single mom with 2 kids. So like, I do feel like constantly the grind. And I know a lot of people and adults, feel like that. But man, I'm like, I would really like to not feel like my day is just so incredibly stretched all the time. And I think that me, and I'm sure other people feel this, like just get used to being stressed. That like, yes. I'm not even aware I'm stressed because I'm like, it's just normal, right? Until I get a weekend without the kids. Go ahead.
I feel like I left that really in a depressive way. Can I just clarify one thing that's really important?
Please, yeah.
There was a study done on women athletes, and this is in 2006. And it had to do with female athletes and gymnasts in the Olympics. And how are they able to do these amazing things? And the thing is that women, when you are able to economize things, create a better balance with them, you can achieve amazing things. You can find balance as a single mom. You can find balance as a mom with kids and you're doing this heavy workload. That's a doable thing. It's a matter of running those labs and understanding the person in front of you. And a lot of women just need to also find a balance with their downtime, self-care. Mm-hmm. A lot of times you feel guilty about having self-care. A lot of women, not you personally, but just in general.
Sure.
And so the role of the physician in those moments is to help them, because when you have those things right, they can achieve amazing things. Look at those kids and what they could do in the Olympics. Like, what the heck is that? That's
Right.
insane. So I think if you were to work on the economy with these women, I know in my practice, you work on the economy of life with these women, you're able to achieve a better balance, and they can navigate this. It's possible.
Yeah.
I feel like I was being depressed a little. I made it more depressing a moment ago, and I just want to make sure I didn't leave it that way.
No, that's
I'm sorry
okay.
to
And I,
interrupt.
no, that's okay. And I appreciate that, because I think it is, I mean, and that's kind of the point of the podcast and the episode too, is to help people gain knowledge around the topic and help give hope and empowerment in how you can deal with these things and live a better, fuller, happier life, right? So I appreciate the kind of perspective shift there. And I also appreciate the way that you're holistically approaching this, not just a guy that prescribes hormones, right? You're trying to get a full, complete picture and support the patient in their life. And we're not just talking about hormones here. So I really appreciate that. Let's talk a little bit about when it's time to start introducing hormone replacement therapy. We kind of got on this, and then I got on a little bit of a tangent and got a little bit sad. But when somebody's coming into your practice and you're running all these tests and you're starting to get an idea of the levels, now it's time to start prescribing HRT. It sounds like there's different ways for that vehicle, right? Different vehicles for that replacement therapy. And so how do you know what's best? Is it kind of on a patient by patient basis, or are there some forms of HRT that you're like, oh, we really don't do these anymore and this is the best way? Like, just kind of run us through it.
We had a woman present to clinic the other day with one of the physicians I work with, and she felt weird. She had no libido. She felt uncomfortable. We ran her labs. Her doctor ran her labs. Her husband had switched from injectable testosterone to topical testosterone. And this woman had so much extra testosterone
Interesting.
that she no longer had the benefit of libido being elevated. None of that. She had more testosterone than an average guy does.
Whoa.
Because she was getting the rub off of the topical onto her.
Whoa.
When you put topical testosterone on a surface, you can just put it on like a tabletop and leave it there for 10 years and come back. It's still there.
What?
It doesn't go away.
That's
and there's no
crazy.
straw on the surface of your skin to suck the testosterone into your body. So you're relying on some of it to transfer over, but there's a lot of it that doesn't, which goes into the environment around you. I don't do topical hormones because it's unethical. No one signed up for us to spread it to other people. Well, I love when they tell women, you just put this topical estrogen transvaginally, you're fine. Until she has intercourse with her husband, and now his penis is being exposed to all that estrogen. That's not a good thing. That's not ethical. So I avoid topicals because of that. There are very rare cases where I'll need to use topical. Like boys who are born with there's certain endocrine disrupting compounds that are so profound that boys are being born now at higher rates with micropenis. So I'll use the topical testosterone in their case because I'll have a higher rate of conversion to dihydrotestosterone on their penis. And that's really helpful there. So sometimes the delivery system creates so many side effects, but in some ways I can use it to benefit the person. So I guess I'm rambling, but let me just be really clear. Just because it doesn't work for this person doesn't mean we shouldn't have it for this other person,
I gotcha.
for this other circumstance here.
Yeah.
So there's going to be injectable, there's going to be oral, there's going to be topical, there's going to be subdermal implants. Those are your 4 big ways of getting into the human body. And each one carries its own side effects and benefits that you have to be aware of with the woman or man in front of you, and making sure that when you're going to give it to them, they're aware of it with you, and you're making sure you take good care of them and running the labs around that delivery mechanism.
Yeah. I think one of the big with testosterone therapy, I feel like this is somewhat recent, but maybe it's not, of TRT, testosterone replacement therapy, like compare it to something like enclomiphene. To me, it seems like a night and day difference. With TRT, you get more of like this, and honestly, to me, it seems like for those out there that kind of know the differences between this, it's like taking straight growth hormone versus taking Somorelin, right? It's kind of the same thing, more or less, with testosterone, TRT, and enclomiphene. I don't know.
Except for Somorelin, your body makes Somorelin. It's growth hormone
Really?
releasing protein. So it's your hypothalamus. It's what it is. That's a peptide your hypothalamus makes.
Mm.
And it sends that to your pituitary saying, make growth hormone. So it's natural. Sermorelin is like just beautiful.
Yeah.
It's very elegant. It steps into the system the way it should be.
Yeah.
That's great. Clomid, that's like black box medicine. It's like, no, black box is not the right term. I shouldn't use that word. Because black box is like cancer warnings. It's just black magic, I think. What you're doing is you're hammering on the pituitary and you're blocking off these estrogen receptors, and the brain's like, I need more hormones. You really are amping up the pituitary. You're manipulating the system. Now,
Gotcha.
I use clomiphene. I use
Yeah.
these medicines, but they're not benign, and they're not my favorites because they're not benign. But when it comes for a man who has zero sperm count, and I could use this to get a sperm count going, I will do that. I
Yeah.
will do that.
Or in the
It's
case
just-
of a man
yeah.
who wants to increase his testosterone but maintain his fertility, because like if you're just getting into research on testosterone therapy, like you may or may not know that when you take large amounts of testosterone in your body, your testes actually shrink, because it's essentially your testes are what's in charge of like one of the parts of your body that's in charge of creating testosterone. Like if you, I think I've given an example of this to some of our staff at work, where it's like if you are a pie maker, and your job is to make 10 pies a day, you're like, okay, great, I'm going to make 10 pies a day every day. But if suddenly like one of your neighboring companies comes up and gives you 100 pies, you're just going to stop making pies, because like now all of a sudden, so it's kind of like, I don't know, maybe you can tell me that that's a good analogy or not, but just like if all of a sudden you inject all of this exogenous testosterone into your body, your testes are just like, great, I can take a vacation, and then they shrink.
Yes.
And so in that case, if a man wants to maintain fertility, I guess that's a good use case for enclomiphene.
Yes. And to speak to what you're saying with testosterone delivered is just like contraceptives, but not as good. And so when a man takes testosterone, it's sort of like he's taking birth control, but you can still get pregnant with it. It's not perfect. You still have some guys that'll make sperm count, but it is completely reversible. When I give a man injectable testosterone and I discontinue the testosterone, whatever his fertility capacity was before, it remains. It does not cause damage to it.
Gotcha.
I point out like Arnold Schwarzenegger.
Yeah, that's a good example.
That man was big. The man was juicing.
Yeah,
I don't know if I'm allowed to say this online, but he was. He had fun. He was doing testosterone.
Yeah,
There's
yeah,
no other way
yeah.
around it. And I mean, he has kids. He had kids after he'd abused testosterone at high levels for a while. He had an accidental child.
How long does that take? So if someone's taking testosterone, TRT, and they're going through whatever phase they are, and then let's say they get off and they want to have kids, how long does it take for that capability, generally speaking, to come back?
It depends on. Okay, let me say, this is important. There are no normal men anymore.
Yeah.
None.
Yeah. Well,
You will never see,
Yeah.
or it's incredibly rare to see a 900 testosterone anymore.
Wow.
In blood. You just don't anymore. That's just not there anymore. I mean, sure there's outliers, and I've seen them rarely. It's like, just, wow, look at that. It was always surprised when we find it. But it's become less and less common. So we don't see normal men anymore. So if the men are no longer making testosterone, it's the same pathway that microplastics are causing damage, that phthalates, rather, BPAs are causing damage, that their sperm counts are going to be low. So if we have a guy who presents to clinic with a testosterone and he's, like 20 something years old and his testosterone is like 200, his sperm counts can be real low.
Yeah.
So if I give him testosterone to bring him back to normal, he's good for a while. And say he's like, you know what, I'm trying to go off testosterone, I'm ready to have a family. We taper him off testosterone, but I know for a fact he's going to have low sperm count, and I'm going to get ready to run those labs. Most men opt not to do this, but I offer to every man, if you want to do testosterone replacement therapy, it's a good idea to check your sperm count, to know what you're going to be dealing with when you do choose to have children.
Yeah.
So that way, when you discontinue it, you know how aggressive we need to be. Do we need to give you Clomid right off the bat? Can we just wait? Do we give you human chorionic gonadotropin? By the way, human chorionic gonadotropin, HCG, That's analogous to Sermorelin because it's the same stuff. It's stimulating the message, stimulating the pathway to the brain, to the pituitary, make more. That's what that is.
Yeah.
I think that's a good time because we're going to run out of time. And I know we wanted to touch on human growth hormone and Sermorelin. So maybe you can just talk for a minute because I know a little bit about peptides and I didn't even realize till we were having a conversation a couple of months ago, the differences. And like, I had kind of been pitched semaglutide as this thing and it wasn't the thing that I thought it was. I was actually thinking it was Sermorelin. And so I was very confused and I wish that I'd had more knowledge because, there's peptides that are being talked about so much now out there and especially, what they can do for weight loss, et cetera. And so could you take a moment we've kind of touched on it a little bit, but let's just go into some more detail on what is Sermorelin, what it does in the body, and why it might be useful or you might prescribe it for a patient.
Sure. Sermorelin it's based off of human growth hormone releasing hormone. So your hypothalamus sends the signal to the pituitary to make growth hormone. So that's the signal that comes down, and then your pituitary makes growth hormone. As you get older, you send less of that signal to the pituitary to make growth hormone. If you take that person, you give them Sermorelin. Sermorelin is a condensed version. It's just a snippet of that protein of human growth hormone releasing hormone. It's a snippet of it, but it's enough to stimulate the pituitary to make growth hormone. So you're returning the body back to a better balance by giving them Sermorelin because you're giving them what the body recognizes and would use. And so now the pituitary maintains that production. You cannot get supraphysiological levels of growth hormone even if you just gave them tons of Sermorelin. It won't work. You can never give them too much. The body has tight controls over it when you deliver it that way, and it works really well. There are other things that we want to give with them to help stimulate the pathway. One of them is a ghrelin analog, which is, if you're really hungry, you release ghrelin.
Yeah.
Ghrelin, when you're fasting, it stimulates the brain to make more growth hormone. So you can use that as called growth hormone releasing hormone, which is growth hormone releasing protein, rather. Growth hormone releasing protein. Growth hormone releasing hormone is Sermorelin. Growth hormone releasing protein is more based on ghrelin. And those two combined, you get better growth hormone secretion in those cases.
Okay, that's interesting. I didn't know that about ghrelin. Ghrelin being the hunger hormone that when that's released, you feel hungry.
Yes.
Right? Okay. And so when and why would you prescribe these to your patients?
A lot of people, I test their growth hormone metrics right away. First thing I do. And when I start treating them with testosterone, when I start treating with their diet, if I do everything right, I see them come up with growth hormone right away.
Okay.
You can make it naturally by optimizing diet and lifestyle and optimizing their endocrine system. Thyroid will optimize it. All these things will make more growth hormone. They do. It's a fact. But sometimes it's just not happening anymore. The brain kind of just starts to age. It just doesn't produce anymore. And that's when you want to try to give them a little bit more Sermorelin directly. See if that works better. You give Sermorelin, and you do that with different growth hormone-releasing hormones that work with it. Ipamorelin is one of the ones I prefer using. That combination tends to work really well for me.
Awesome. Did you have more questions about it? Because I know you were curious.
I did. So I have one specific question about Sermorelin. So with Sermorelin, this may or may not be common knowledge, but like the primary time that growth hormone is released in the body is during sleep. And so when you take Sermorelin, one of the first things that a lot of our patients talk about is how like they feel like they're waking up with amazing sleep. Huberman actually just did a recent episode about peptides, and he talked about Sermorelin. One of the concerns that he brought up is that it emphasizes, when you take Sermorelin, it emphasizes the deep sleep portion of your sleep cycle, and that it essentially steals hours away from the REM, the rapid eye movement sleep. I don't know if that's something that you've seen or encountered during your practice, or if you have any strategies for like trying to reallocate those stolen hours more or less from the deep sleep to the rapid eye movement.
I've never seen it clinically, and I use these heart rate variability monitors with all my patients these days. They use a watch, or they use the Ring or the Whoop band, and I monitor their sleep because it's a part of practicing medicine is to understand how your patients are resting.
Yeah.
But I haven't seen that. I actually have not seen that.
You haven't seen that. Well, no. I'm currently on Sermorelin, and I'll tell you what. Previously, we had another sleep doctor on our episode and on our show, and told him that like I hardly ever dream. I started taking some more, and my dreams came back, and they're kind of vivid. And it's like some of them are like me training with The Rock. And just random people. I'm like, this is an awesome dream. And then I wake up in the morning. I work out first thing in the morning. So it's great. Yeah, I've been loving it. So yeah.
Just a kind of a little tangent, but you mentioned your Aura Ring. How much do you recommend something like that? Because we're learning more and more with every single guest that we have, the importance of sleep. And, if you asked anyone, they would probably be like, yeah, I know sleep's important, but I don't think a lot of people understand how important it is and how much it impacts. So maybe you could just briefly say, like, what is the benefit of having something like an Aura Ring that tracks your sleep cycles?
I don't work for Aura Ring.
Okay.
It's not me trying to sell their product. I use it for so much of the practice, for not just sleep, but also stress management. How are they taking care of themselves? What's their downtime like? Sleep schedule, sleep hygiene. Are you doing downtime before sleep? Because a lot of these things, you can use this and check out to see if their stress levels are going down before bed and see what's their hygiene level like how are they. Hygiene's not just washing your hands. It's like how you're living in a healthy way. So if they're doing better hygiene, you can see that on these Aura Rings. You can monitor their fitness, their output, how well they're taking care of themselves with their steps, they're working out. It's a really good tool for accountability for the person, because this is the best thing about it. Once you put that on them and you teach them how to monitor it and care for watching this, that it works, you're able to give them a tool where they don't need to keep coming back to constantly running labs to see how they're dealing with their stress. Because they become empowered as the patient themselves, and they just understand how this works.
That's cool.
Like cold plunges don't work for everybody. How do you know? The heart rate variability. Some people can meditate all the time. It doesn't work for them. Heart rate variability. Deep breathing. That only works for some people. Who does it work for? This is one of the tools you can use to find that out. And you can create a better protocol based upon the data that it gives you.
Well, you may not work for Aura Ring, but I'm sold.
It's really cool. I mean, they're using it at the Olympics this year. Did you see that?
No kidding?
Yeah, they're going to do it on the parents of the kids. So you're performing in the Olympics. Your parents, and I don't watch the Olympics. I've covered the Olympics twice here. I don't really watch the Olympics that much. But like the parents are going to wear their heart rate variability monitors to see how much stress they're under when they're watching their kids perform.
Oh my gosh.
Yeah,
I can only imagine. I can only imagine. When my son, 8 years old, is playing his first season of soccer, I'm like ridiculous. I'm like so into it. So like I can imagine if he was in the Olympics, I'd just like pass out.
I still was joking around, Steve. This is how you're going to figure out which parents really love their kids.
Oh, gosh. Yeah. Or which of them are just really seasoned handling their stress.
Yeah, seriously.
Yeah. I guess I didn't even realize, thinking about the Aura Ring being able to monitor so much more than just sleep. Technology is insane. Like, it's just gotten crazy to think that something just like on your finger could tell you so much. That's wild. Yeah. And I love, though, that you're using it in a way, I think this sort of an overarching theme that I've heard with you and that I just want to commend you for is the way in which you're caring for your patients that is holistic, all-encompassing, and also empowering, right? To try to not make people a slave to specific medications or to continually having to come in over and over and over again. I feel like so much of our medical field has gotten in this cycle of we're just treating sick people and we're not really trying to get to root causes or figure out how to make people well. And so anytime we're lucky enough that we've gotten to interview, quite a few doctors who are this way. And every time I just feel grateful. So I just want to say thank you for the way that you're approaching your patients and the way that you're approaching your practice and the overall impact that it's going to have, because we need more people like you in the medical field.
Thank you. Thank you.
You're welcome.
Yeah, I definitely can echo that sentiment as well. Like, you obviously know your stuff, and I think that you've well earned all of the accolades that Natalie read off at the beginning. It's been an absolute.
Someone wrote that. I get very embarrassed about that. I'm just in my living room right now. My dogs are around me.
I love
an everyday guy.
This
is my nerdy stuff I love.
Yeah, you can tell you have a passion for it.
Yeah, 100%. Well, it's been an absolute pleasure having you on the podcast. We would love to have you back to talk about more of this. I mean, I feel like we really just barely scratched the surface. Yeah. But if people want to learn more about you and your work, you have a local clinic, right? Where's that located?
We're in Chandler, Arizona. We're going to move to Tempe in a few months, but we're still in Chandler. We're moving to a bigger office. But in Chandler.
Awesome. And do you have a website that people can look and see more about your
You
work?
can tell I'm not a very good marketing person. I didn't have business cards, but it's a Protea Medical Center. It's just protealife.com.
Okay.
Awesome. Well, Dr. McCarthy, again, thank you so much for joining us.
Thank you for inviting me. It means a lot to me. I always love talking about this because I feel like when we do these things together, when we talk about this stuff, like what I love about this thing, and I know you do this too, you have no idea who you just touched today.
Yeah.
You know what I mean? You have no idea somewhere in another part of the world just heard what you said, a question that's the same question they had, and you get clarity to them, and you have no idea whose lives you've changed. Or this kid gets inspired to get into this field because of what you just said.
Yeah.
It's such a phenomenal thing we're able to do together that we were never able to do this before.
Agreed.
So thank you for giving me this opportunity to be here with you in this moment. And it's exciting.
Oh, I love it. It's been such a pleasure to have you on and to interview you, and your bright light and your energy was just infectious. I felt kind of down when I came in and need to get it up, and just watching your passion as you talked about things really, really lit me up. So just thank you for the way that you showed up, and thank you for making the time to chat with us.
Thank you.
Thanks for tuning in to the Invigor Medical Podcast.
If you enjoyed today's episode, you can support us by liking and subscribing.
Your feedback matters, so feel free to share questions or future episode ideas in the comment section.
For more information about our prescription strength treatments for weight loss, ED, and overall wellness, all from qualified doctors and reputable pharmacies, visit us at invigormedical.com. And don't forget to use code podcast10 for a 10% discount on your first treatment plan. Until next time, stay well.